Welcome to the Applied Sports Psychology and Injury Research and Education Lab podcast, also known as the Aspire Lab podcast. We created this podcast to further understand sport injuries and learn more about them from the people we interview. Okay, welcome everyone to the Aspire Lab podcast.
I am Eddin Djelovic.
And I'm Connor Kahoun. Today we have our guest, Jean-Pierre. And
he is a UIC Kinesiology graduate and is currently in the master's program for athletic training at North Park University. He has experience in clinical placements from DePaul University, Lake Forest College, and the Chicago Bulls. We brought you on the podcast today to discuss your experiences, both personal and professional, with a focus on the topic of concussions within sports. Hi, Jeff.
How you guys doing?
good, how are you?
Doing all right. Can't complain.
Awesome.
All right, so our first question for you is, what role does an athletic trainer have when an athlete experiences a concussion?
Yeah. So the role that an athletic trainer has, especially when dealing with concussions or an athlete that might have sustained a concussion during a practice or a game, would overall basically be the diagnosis, management, and the decision making in terms of their return to play status and protocol. So let's a hypothetical example. Let's say we were in a football game and an athlete got hit by an athlete blindsidedly and he fell down to the ground. It would be my job to run out to the field, assess them, and if they were coherent enough and they were able to get up on their own power, then I would bring them to the sideline, have them sub out, and then go through a concussion protocol. There are different protocols that I'm pretty sure we'll probably talk about later that we'll get into. And there's a specific one for on-field, and there's a specific one for another time, in our athletic training facility that we would do. And so, depending on the severity and depending on how the athlete might have conducted or done on the on-field, would determine whether we felt good enough to send him or her back to the field, as well as needing to shut them down and having to reevaluate them later.
Okay.
Yeah.
For the second question, what are the physical and psychological effects for an athlete who experiences a concussion?
Yeah, so there could be a couple physical and a couple psychological effects that could be sustained after getting a concussion. I would say that the biggest thing, or one of the things that you might notice the most, especially on the physical side, would be loss of balance, muscle coordination being kind of out of whack, as well as going into the physiological aspects being maybe depression or anxiety coming from the return to play protocol, especially if an athlete has sustained multiple concussions. A lot of the times, if it's a hard enough hit, you'll notice those physical imbalances right away because they might have those dizziness or those balance problems as they're getting up and walking to the sideline, even prior to us conducting the on-field assessment. So seeing that, and then kind of once we're done helping them through the whole protocol and return to play, you more so see the physical first, and then it's sometimes it'll be followed by the psychological, more so when they're getting closer or ramping up, trying to get back onto the field or the court or whichever sport that they're playing. Mm-hmm. I would say that I personally don't have a lot of history dealing with the psychological aspects, but there are you will see that, especially with seasoned athletes who have been through different types of either injuries, concussions, or other maybe dilemmas that they might have been going through. You'll more so see it in that type of population more so than an acute or a person who might have developed it instantly or their first time, especially if they're younger or a freshman in college. They're going to be eager for the most part to want to get back out there. And you don't really see those negative psychological effects that happen unless it was severe enough.
Okay.
Yeah.
I see. How about other physical, concussion? Once they have the concussion on the field, so you were saying a lot of it was physical, balance stuff. Are there other things indicators that you see except for balance?
Yeah, so with physical and the things that you might see, in the beginning, outside of like maybe balance or like muscle coordination. It would be more so of like the symptom side that the athlete we would see, or either the signs that they might be exhibiting or the symptoms they show us. More so like, you know, straying away from balance, maybe like their dizziness, they might have like a headache. You typically wouldn't see any like obvious deformity, because if you saw like a deformity on their body, then it would be even more than a concussion. It would be like a fracture, right? Like if they had something broken, or if you saw blood, that would be more so of an injury or some type of damage that was outside or on top of a concussion. So particularly with concussions, especially on the physical aspect, it's more so of that muscle coordination, that dizziness, that headache, not being able to really like gather yourself and being disoriented. That's really just like, I would say like the, what's it called, the major barometer of physical damage in terms of concussion. Yeah.
All right. What are their treatment plans to assist with their physical and psychological health to get back to that normal
Yes.
level?
So for the physical aspect, to get back to normal, that's where we would do one of our protocols. Like kind of talking about the on-field one. That was like a condensed version. It was what we would call like a SCAT-3, and like something that we would do in the athletic training facility is something that we would call a SCAT-5. And so those two tests, like the SCAT-3 is just a smaller condensed version of the SCAT-5. And with those type of testings, we kind of go through the whole symptom sheet. We ask them how they're feeling. We try to see where their memory is. We try to find out where their neurological senses are. So like if they can feel their fingers, if they can feel their toes, if they can feel their arms. We monitor their balance, having them do different types of testing, as well as cognitive training. So we try to test all those things, and if they were to not look good on the initial on-field, then we would do a more extensive version of that off the field. And if they were to have high symptoms off the field as well, that's when we would start our return to play protocol. And for concussion, there's not something that we can like necessarily put like, you know what I'm saying, like a taping or a wrapping or like antibiotics on. It's more so something that we're going to have to give them time, and the biggest thing for them, it would be rest. So we would have this protocol, have them come in, hopefully, and we would need them to have 24 hours symptom free. So regardless of however long that takes, we need them to have a full 24 hours of having zeros across the board from this symptom sheet that I was talking about. And then once that's the case, then we kind of go into that protocol that I was talking about, where we would have different days having different goals. So after the 24 hours, we would have technically the second day, where they would be going through light aerobic exercises to try to, you know, work on their blood pressure, work on their heart rate, their respiratory rate, so on and so forth. The next day 3 would be sports specific. So we're making things a little bit harder. They might run for a little harder. They might do things that you might see in their sports. So like a basketball player might practice some form shooting. And with that in mind, we still want to work on the blood pressure, heart rate. But we're just making it a little bit harder, ramping it up. Day 4 would be non-contact training drills, so they can participate with their team, but they can't do all of the things. Like they can't, basically, if it was football, you can't collide with your other teammate. But if you're a receiver, you could have your quarterback, you could work on running routes with them, catching like footballs without being hit. Those are like what some of the things that we would have you do in your 4th day. 5th day would be full contact, full practice. So that's really just trying to get you back into the swing of things, getting your confidence up, being hit, seeing how that feels. And then the final would be full clearance. So that's really how we would try to assess and treat the physical aspect of it. The psychological aspect is where, you know, maybe we talk to a sports psychologist and see if there's a way that you can kind of talk about how you're feeling, about ways that, you know, you saw yourself prior to the injury compared to post or during the treatment process. There you can, you know, have a one-on-one with a sports psychologist, or you can kind of work in like a supportive group. I'm not too well versed in how the support group works, but I do know it's like a smaller group of people probably dealing with like a concussion or have dealt with a concussion with a sports psychologist. It could be some members of your team and just people who you trust, a safe space where you can kind of have conversations about how you're feeling in the direction that you want to go after sustaining a concussion. That along with peer modeling, talking to people who you trust. That could be your own like psychologist, doesn't even have to be the sports psychologist. It's kind of just working on feeling as if you're in a safe space to be able to talk through anything that an athlete might be going through and to kind of feel comfortable enough in whichever decision that, is made by the athlete, athletic trainer, and the providing physician as well.
Okay, cool. I have a follow-up question to that.
Yeah.
So for these tests that you do on and off field,
Yeah.
does it vary depending on the sport, or does it have a lot of overlap?
So it typically has a lot of overlap. Like you would ask the same type of questions for a football team that you would ask for a soccer team or a basketball team or rugby or lacrosse, so on and so forth. Because the reason why is like those questions. Like I'll give you an example. Let's say you were to have sustained a concussion, right? Mm-hmm. One of the things that I would ask you after walking out the field would be like, hey, do you remember your name? Do you remember who we're playing today? Do you remember within the hour what time it is? You know what I'm saying? Mm-hmm. Those type of questions are very broad and generalized. And so you can ask them throughout any sport, any person, because at the end of the day, we just need to know if you're coherent or if you have enough of your senses together to be able to answer those type of questions. You know what I'm saying?
Yeah.
So that's more the broader sense, right? And then like an example for like a neurological testing or a balance test, I might ask one of you to just like stand with your arms out and your eyes closed, just seeing if you're able to hold yourself together and not sway from side to side. Or I would have like a sharp and soft tool. I would rub it on a certain area of your body and ask you, tell me if it's sharp, tell me if it's soft. And if you were able to get enough right, then, you know what I'm saying? That means you would have passed that testing.
Okay, cool.
Yeah.
Cool.
And then when you were talking about the athletes after they've had a concussion kind of getting back into that return to play and meeting with those sports psychologists, for the lower, not like high level play where it's sort of like professional, but for lower level like college and maybe even like high school, do they have that kind of accessibility for that sports psychologist?
Yeah, so that's a good question. I could definitely speak on the college behalf. For the most part, at every level from D1, D2 to D3, most of the times teams are going to have a sports psychologist assigned to the team, assigned to the school. Oh. So it wouldn't be like a specific one to a specific team like how we would be in the professionals, but there would be a sports psychologist on staff, and any member of any team could go and see that sports psychologist in order to receive that help. For the high school, there isn't necessarily a sports psychologist assigned to one certain high school. However, there could be people who are either contracted out, who have a certain district that they may work with, or you would go to your primary care provider and then they would lead you to just a generalized psychologist to be able to help with that. Because obviously, the money ranges in the affordability for different types of professions differ at different levels. So that's why it would be a little bit different at each level. But for the most part, there will always be someone to go see because it's important, and you need to be able to have some professionals to talk to in order to help deal with that. And so whichever avenue that you go, whether you make it all the way to the pros and you have one literally in your same building, or if you have to kind of walk to a different location like in a college, or have to be referred out to one from your primary care provider in high school, there should always be someone to be able to help you through those, psychological ailments or anything that you're going through.
For the next question we have is, have there been any athletes that you have worked with that were hesitant to return to play due to their previous concussion?
Okay, so with that question, I haven't been, I've worked with different teams in different locations, but for the majority of the time that I've worked with those teams, I've always had like a superseding like preceptor, and so I would be more so speaking from the conversations that I was a part of, but didn't necessarily manage myself, because I never had a person who had a concussion who was hesitant to return to play necessarily, but when I was brought into different locations, there might have been someone who might have already been dealing with concussions or multiple concussions, and I kind of just listened in during their conversations with their actual athletic trainer, and then we kind of discussed like avenues after. So I'm going to really talk from that perspective. When I had a clinical rotation at North Park, and we had an athlete who sustained multiple concussions throughout their career. They played multiple seasons, and I don't remember exactly the number of concussions, but it was more than 3. And so the athlete was talking with the athletic trainer, and they were kind of discussing how, hey, you've sustained a lot of concussions. Your collegiate career is almost coming to an end, because I believe they weren't trying to go pro, but they were more so trying to coach the sport eventually, but they just wanted to play out, their last season. They had sustained a concussion at the beginning of it, and conversations were made based on what the best route would be towards their future. And it wasn't an easy conversation. The athlete felt as if they wanted to compete. However, kind of like how we're talking about, there was a little bit of that fear to re-injure themselves and make things worse or not feel the same after. So how we kind of talked about it was, we'll go through the protocol like normal and like usual, and depending on how you feel, along with how conversations goes with a sports psychologist or with the coach as well, along with the physician and athletic trainer and their family, will kind of determine whether or not they return to the field. Long story short, they were a little bit unsure about like the pros and the cons. Like they were trying to weigh which option would be better. She wanted to become a coach regardless, so she thought, and had the conversations with people like, hey, let me see how I would do coaching or helping to coach in my final season as like a player coach almost, and an assistant, and seeing how that kind of gelled with the team and how she could find ways to help the team that way. And we kind of were like, okay, if that's the decision that you want, everyone's going to be fully supportive. And we kind of worked towards helping her get healthy to be able to coach, if that makes sense. There are other instances where I have personal experience with someone who has sustained multiple concussions, and they still kept playing sports. This is more so of like an outside of my clinical experience, where I knew someone who had 5 concussions, and he continued to play basketball because he would work with his athletic trainer and his physician, and he would always get back to feeling to where he felt comfortable enough to continue playing. And so it wasn't an issue for him because he loved playing, and he wasn't afraid of anything that could have happened or the worst case scenario or anything like that. He just always was someone that kind of wanted to, just do whatever that made him feel good, and that was playing basketball. So every time he might have sustained a concussion, he went through the protocol, he felt good. And so that gave him the confidence to keep going until he was done playing basketball. So those are really like the 2 that kind of stand out to me. There were other times where I had an athlete sustain concussion, more so my one-on-one experience with them would have been their first ones. And so we kind of just went through the protocol, and they went back to playing without any other like derailments or any feelings of as if they're afraid to go back. So those are really the 2 that stand out in terms of like your question of, the ones who were hesitant to return to play or not.
So then are you saying like it really ranges with?
It ranges, yeah, right. So it's like, I would say more so athletes who would be hesitant to return would be the ones who sustain multiple ones, more so than the ones who might have just gotten their first. Like if this one basketball player were to have continued getting concussions, who knows, maybe down the line he would have been a little more hesitant. But it really just depends on where you're at in life, where you're at in your season with your sport, and what you want to gain from it. You know what I'm saying? And so that's all the culmination into the decision making that group of people who I talked about kind of talks and makes.
A follow-up question to that.
Yeah.
So after a person experiences a concussion, have they had like positive feedback where they're like, all right, this is my plan, I'm going to do this? And then also on the other aspect, have people experience like the negative side? So like essentially, are there two different directions that a person can go?
Yes. Kind of going back to those two that I talked about, the athlete who became a coach was more on the side of not feeling too great about it because they didn't want their season to be over. They wanted to finish the last year playing. And so there was a little bit of that negative connotation to where they weren't as happy with the result or with how they felt. And so they made a decision based off that, whereas the basketball player felt good in his return to play every single time, and he felt confident, and he knew the repercussions that could come with more concussions. However, he prioritized playing aspect, and he knew that he wasn't going to play that much longer himself, so he just kind of just wanted to finish it out, and it didn't stay on his mind as much because he just had that goal to finish. Mm-hmm. Whereas the other athlete was thinking about being a coach regardless, so this was like a smoother transition, even though they felt a little poorly about it in the beginning.
I see.
Yeah.
Okay.
And then, besides obviously helmets for football players,
Right.
Are there any precautions that athletes can take to reduce that chance of concussion or reconcussion?
So yeah, that is an interesting question. Like the literature and the research like talks about how there, even with like helmets and mouth guards, it's really like inconclusive to its effectiveness. I would say a big factor in probably or maybe reducing concussions would be just form and technique, especially in those collision sports. Being able to not lead head first when making a tackle, or if you're making like a header in soccer, trying your best to stay away from colliding with another athlete. I would say more so technique and form would be your best way of trying to mitigate it. However, like other protective equipment, and like maybe the timing of practice or games and stuff like that, they don't really play a big role in stopping a concussion, because you can be helmet, shoulder pads, mouth guard, and everything, and someone can just blindside hit you and causes you to like whiplash. You're still going to get that brain shaking, causing that concussion to happen. So I would say more so just kind of being aware of your surroundings, as well as trying to be as technical in your techniques as well as your form in the certain things that you do and the motions that you make would probably be the best way to mitigate it, if at all reduce. Yeah.
Do you have any questions for us?
Yeah, so I was just curious, like what made you guys want to, or what made you curious about concussions? Did you guys have any experience yourself, or were you just like wanting to kind of dive into that sort of area of, like concussions and everything that kind of goes with it? What was like the driving process of wanting to have this conversation?
Mm-hmm. So we're part of Spire Lab,
Right.
And that was like one of the reasons why we created the podcast.
Right.
So our first podcast episode focused more on like the direction of like eating disorders and disordered eating. So we had a person we talked to that had like experience with like bodybuilding and stuff.
Yeah.
But our professors wanted us to discuss this topic next, but we also felt that this topic like really overlapped with like the next episode.
Gotcha.
And plus, I mean, your experiences, like your clinical experience as like an athletic trainer, is really like eye-opening and very, very interesting to see like your point of view.
Yeah, I appreciate that. Yeah, and I think that's really interesting too. Being able to kind of connect and have that overlap is pretty interesting. Do you mind, and maybe like it can just be a hint, and if not, to like give off for the viewers, but like what is like, how does it overlap with what you're talking to next, without having to spoil it if you guys didn't want to?
We actually don't know who we're talking to next.
Gotcha.
Yeah.
But I was thinking more so like the topic. Do you know what type of topic you guys want to have?
We have no idea.
Gotcha.
Yeah. Do you have anything else to add to that, or?
Well, so I think what really got us into concussions was, so our professor, John Kumlili, once, I believe his name is Tua Tagovailoa.
Yeah.
On the
on the Dolphins.
On the Dolphins, he had his I believe it was a concussion where on the field, and he had another concussion, I believe, like the next game.
A couple of games, after,
Dr. John sent us a video about it and a couple articles that really sort of pushed us into that direction so we could talk about these concussions as well and see your point of view, athletic trainer's point of view on how maybe we could, what the proper precaution is basically for like returning him to play.
Right.
Because I feel like that quick turnaround of him coming back to game and then it re-injuring himself with that head injury sort of nudged us in this direction to sort of take a look and see if there was maybe precautions that they did or didn't take.
Right.
I know that there were some articles about it saying like, oh, the athletic trainer didn't do this or didn't do this or something. But I just want to hear your point of view as well.
Right. Yeah. And you guys are talking to someone who is very new and very fresh, you know what I'm saying?
Yeah.
Sure. I am officially graduating in May and I just took my BOC, so these are all my experiences coming from my clinical rotations more so than just my own like personal practice. Of course, with these rotations, I get autonomy with my athletes or with the athletes that I get to work with, but it's, you know what I'm saying, like it's just this is all within 2 years.
Yeah.
Whereas, obviously, some athletic trainers are 15, 20 plus years into their career and so yeah.
But to add on to that, I mean, you have your clinical experience. You have a lot of experience with it. I know you say you have, it's not that much, but I mean, the way you're answering these questions are very much on top of it.
Yeah.
Congratulations to graduate. I mean, I hope you do well on your test.
Thank you. I appreciate that. We find out in 2 to 4 weeks, so
Sweet.
We're trying to, just be as calm as possible and just to wait and see what kind of, what the results would be and hopefully being able to work straight after.
Good luck.
Yeah.
Thank you.
All right, cool.
You have anything else?
No, that's it.
Yeah, all right.
Awesome.
I appreciate you guys having me on.
Yeah.
You're welcome.
Of course.
Thank you for joining us.
Yeah, no problem.
All right, did you want to?
Yep, I'll finish her off. All right. These are all the questions we had for you today. Thank you so much for taking the time to come onto the podcast and discuss these topics. We'd love to have you on the podcast again.
Oh, 100%. Anytime. Please, just let me know. And I appreciate you guys having me. I thought the questions were awesome and the dialogue that we were able to have. And I just appreciate that you guys were very in tune in the conversation as well. And just, what I'm saying, like excited to find out what I had to say and asking the questions that, that flowed off and the questions that you were curious about throughout the answers and the dialogue that we had. So thank you too. I appreciate it.
Thank you for listening to the Aspire Lab podcast. If you're interested in more information about Aspire Lab and kinesiology at the University of Illinois, Chicago, please feel free to email us at aspire@uic.edu.